Welcome to Pain Relief in Motion. I'm Bobby Olden, and I'm here with Dr. Frank Hackl, who is a board-certified anesthesiologist and a board-certified pain management doctor. And he's been doing this for about 20 years, and we are going to be talking about challenges and misconceptions that patients have for starting exercise programs when they have chronic pain. What are the most common challenges or barriers that patients with chronic pain experience when trying to start an exercise program?
So it can be a few different things. Number one, fear of the unknown, fear that exercise can make their pain worse, and then not knowing what to do to make themselves feel better. Typically, we like to start somebody in physical therapy to help direct them in what to do. If finances are difficult and they can't afford physical therapy, then we talk about yoga. You can find yoga classes online or go to a class. Typically, we'll have them start with chair yoga and then build up to mat yoga over time. Another good exercise to do would be any sort of water aerobics. Swimming is a very good. I want to make sure that the person understands that overall exercise will help them. They may initially have some increased pain due to muscles they haven't used before. We want to make sure that when the patient is exercising that, again, they understand a little bit of pain is okay. Severe pain, they need to stop and then readdress what have they done to cause that. We always want to make sure they have a physician they can reach out to discuss what they're doing, and if they have significantly increased pain, they can help them work through it.
Are there any specific reasons where patients with chronic pain should avoid certain types of exercises?
We want patients with chronic pain to start with simple exercises, body weight exercises, use of bands to help strengthen and stretch. We want to avoid any high impact exercises, no running, no jumping, no CrossFit.
What would you recommend as a safe starting point for someone who has never exercised due to fear of pain or injury?
Definitely would like to get them with a physical therapist, as I mentioned earlier. Again, sometimes that is cost prohibitive for some people. Therefore, a good yoga instructor can help them with starting exercises. And if that is cost prohibitive, I would recommend chair yoga they can find online.
Okay, so why is it important to have physical therapy or yoga instructor to help them get started?
There's a couple of reasons for that. Number one, we want to make sure that you're using proper form. If you're not using proper form, you won't really get the benefit of the exercise and you do risk injuring yourself. Someone to help lead you through those exercises can also help with evaluation of what you need the most. But overall, it's just important to move. If you can't have someone to work with you, we start with the most basic exercises that are easily found online. Continued effort will pay dividends.
What are some of the most helpful self-care techniques that patients can incorporate into their daily routines to help manage chronic pain?
So some of that is mental and some of that is physical. We have to be able to convince ourselves that this exercise is going to help so that you have the determination to start. Then it becomes a daily habit that you have to develop. Typically, it takes about 3 weeks of doing something to when it becomes a habit and becomes easier to do. While we want to be active and exercise every day, we want to make sure we start slow and do a small amount and slowly let that build over time. Trying to do too much too fast can cause injury and then set you back.
How important is consistency in exercise for managing chronic pain? And what are simple ways to stay motivated?
Consistency is very important. Improvement will come over time, but improvement is usually slow. You'll be motivated to continue because you're going to find that you're going to have more energy, you'll have less pain, and be able to do more things.
What role do exercises like strengthening and stretching play in reducing chronic pain?
So typically over time, our muscles shorten and weaken. It's very important that we both lengthen and strengthen a muscle. We don't want to lengthen it without strengthening it, as we have increased risk of tearing that muscle. So it's that combination of getting stronger and making those muscles longer.
So, what advice would you give someone who feels discouraged about their ability to manage pain through exercise?
It's very easy to be discouraged when you have chronic pain. It never leaves you alone. It's always dragging you down. It affects you mentally. It causes depression. But if you can start and continue to do even the most basic exercise, you'll feel better mentally and your pain overall will lessen.
So, even if they're doing simple things, it's better than doing no things.
Yes. As I said earlier, starting slow is fine. It's more about the consistency of doing it on a daily basis. You will eventually start doing more as those things become easier. It'll give you the confidence to be able to do more, and you'll also feel better emotionally.